Our story's protagonist is Andy Beckett, a rising star attorney at Wyatt Wheeler, Hellerman, Tetlow, and Brown, a high-power corporate legal practice in Philadelphia, the namesake of the film. Andy is presented as ambitious, passionate about the law, and highly competent in his work. It comes as a great surprise to him then when, right on the heels of a promotion and his deft handling of a tricky case, he's mysteriously let go from his job under the pretext of performance issues. Andy knows that his work performance is top-notch and rightly suspects that his employers have found out something about his private life, namely that he is a gay man living with AIDS. The film is set in the early 90s when both AIDS was still poorly understood among the general public, despite having ravaged the gay community for the majority of the 1980s, and when LGBT social acceptability was still very much on the rise, a time when marriage equality still seemed like only a distant possibility. Andy's correct in his suspicion. His law firm did fire him because they found out that he has AIDS, and because he's a gay man who, not yet out in his professional life because of the cultural climate at the time, they felt had infiltrated their boys' club, his law firm. So the film begins from the start to stake out some themes around heteronormativity and homonegativity in American culture, especially as it relates to HIV/AIDS. Another protagonist is presented to us in Joe Miller, a smaller-time attorney whom Andy eventually hires to take his court case, suing his former law firm for discrimination and wrongful termination. Joe Miller himself exhibits and represents some of these homo-negative attitudes, reminiscent of those operative at Andy's former law firm and among the general public. And his journey throughout the film of befriending and legally representing Andy shows us an arc of growth away from these attitudes. But we'll be taking Andy as our primary subject. Andy demonstrates great need throughout the story, not because homosexuality nor HIV/AIDS present as mental health problems in and of themselves, to be clear, but because the discrimination Andy faces and the illness he is battling take a serious toll on his own mental health and wellness, and he needs support in coping with and making sense of these experiences. This is yet highly relevant, even in our time, even in a time such as our own when there is much greater social acceptability for LGBTQ plus persons and much better understanding publicly around HIV/AIDS, as well as hitherto unavailable medical and pharmaceutical innovations and a panoply of public health resources. It's relevant because LGBTQ plus persons still face discrimination, alienation, and unique challenges in our society. And because STIs like HIV/AIDS are still a public health problem we're grappling with that have real mental health and wellness costs.
So we'll be discussing Chapter 16, which is on sexually transmitted infections, which obviously applies to our client, Andy, who is HIV and AIDS positive. So HIV stands for Human Immunodeficiency Virus, and AIDS stands for Acquired Immunodeficiency Syndrome. So AIDS symptoms often result later after acquiring HIV, and according to the CDC, 1 in 8 people are unaware that they even have HIV. So HIV and AIDS was originally thought to be, quote-unquote, a gay man's disease that could only be contracted by men having sex with men. So this misconception led to decades of negative stigmas and homophobia around those who contracted the disease, rather than working to create some prevention strategies. Now we know that HIV and AIDS can be contracted by anyone at any age. However, gay men and bisexual men and other men who have sex with men have the highest rate of HIV. It is contracted by bodily fluids such as blood, semen, and vaginal fluids coming into direct contact with a mucous membrane such as the vagina, penis, rectum, mouth, or it can be injected directly into the bloodstream through intravenous drugs. The most common way for HIV to be spread is through receptive anal sex, vaginal sex, or sharing dirty needles and syringes. Symptoms are often described as the worst flu ever and consist of fever, headache, body aches, sore throat, rash, etc. Symptoms start to occur 2 to 4 weeks after contracting the virus, and this stage is often followed by what is known as a latency stage, where symptoms are mild or maybe even absent. And it's during this stage that people can start to use antiretroviral medications, also known as ART. So looking at some studies, the CDC used 3 surveillance data sets to estimate HIV testing and HIV prevalence among U.S. adults, state by state, and the percentages of HIV-infected adults receiving HIV care, either through prescribed ART medication, viral suppression, or prevention counseling. So the results of the study showed that an estimated 1.2 million people in the U.S. were living with HIV infection. So improving survival of people with HIV and reducing transmission involves a continuum of services that include HIV testing and diagnosis, linkage to retention and HIV medical care, ongoing HIV prevention interventions, including the ART therapy. Of the estimated 942,000 people with HIV who were aware of their infection in this study, approximately 77% were linked to care within 3 to 4 months of their diagnosis. 51% remained in care up to 8 to 10 months after receiving their diagnosis. And of those receiving care, 45% received prevention counseling, and 89% were prescribed the ART medications. 77% of those prescribed medication ended up showing viral suppression, and an estimated 28% of all HIV-infected Americans in the U.S. Have a suppressed viral load. So moving into looking at treatments, there currently is no cure or vaccine for HIV and AIDS. The CDC recommends when working with someone who has HIV to communicate in a way that does not stigmatize or negatively judge the person, their gender identity, their sexual orientation, their sexual or drug use behaviors, and their medical or social characteristics. They also recommend that you provide information about the rights and responsibilities of the person living with HIV regarding confidentiality, privacy protection from discrimination, and partner notification. They suggest making a collaborative plan on how to notify sex and drug-related partners through partner notification or self-disclosure. And they also recommend providing information and resources that help the person with HIV improve their health, protect the health of their partners, and reduce risk of transmission. So ART, or antiretroviral therapy, is a combination of 3 or more HIV drugs started as early as possible after receiving an HIV diagnosis. And ART can slow the progression of HIV, strengthen the immune system, and prevent opportunistic infections. It can also help reduce chances of infecting others. So when it comes to counseling those with HIV, there are several theories that are helpful, and treatment plans should always be based on an individual basis, based on the client. So depression is prevalent among people living with HIV and AIDS. So cognitive behavioral therapy can be effective by encouraging and increasing adherence to medical treatment. While cognitive restructuring can help assist clients as they work to adjust and accept their HIV diagnosis. Another theory is acceptance and commitment therapy. It's often used to help people living with AIDS manage their depressive symptoms by offering awareness strategies and commitment to behavior strategies, such as medical adherence. Mindfulness-based activities are also widely used to help those with HIV and AIDS, as they reduce stress and anxiety and encourage emotion-focused coping. So moving into multicultural competencies, according to what is known as the Joint United Nations Program on HIV/AIDS, at the end of 2015, there were 5.1 million people infected in Asia and the Pacific, 1.5 million in Eastern Europe and Central Asia, 2.4 million in Western and Central Europe and North America, 1.9 million in Eastern and Southern Africa, and 2 million in Latin America and the Caribbean. So HIV/AIDS is a global epidemic with approximately 37 million people living with HIV worldwide. The highest rates of HIV are in South Africa, along with Ethiopia, Kenya, Uganda, and Zimbabwe. Women account for more than half of those infected in this region. Treatment plans should be culturally appropriate and created on an individual basis. Accessible and affordable care are not always available for underserved areas and populations. There are age, gender, race and ethnicity, and geographical differences in the prevalence of HIV. The highest rates are among males, specifically Black and Hispanic men, as well as gay and bisexual men. HIV rates have increased among transgender adults and adolescents in the U.S. Counselors and educators should take all of these factors into consideration when working with clients living with HIV/AIDS. So, future implications. Sexual educators, therapists, and counselors should be aware of prevention strategies, programs, and high-risk behaviors that increase the transmission of HIV and AIDS. We need to break the silence around sexually transmitted infections and provide education and resources to encourage prevention and reduce the negative stigmas associated with contracting or living with STIs. Educators and therapists should stay up to date and aware of the research around the development of a vaccine and or other helpful medication and treatment options. So in conclusion, the main thing that we learned from this assignment and this semester so far is about the prevalence of HIV and AIDS. I think we've moved away from talking about HIV and we hear more often about your maybe mainstream STIs like chlamydia and HPV. We also learn about the diverse and individual-based treatment approaches and the importance of considering all factors impacting a client other than their presenting diagnosis. We need to consider cultural factors. It's absolutely necessary when working with clients living with HIV/AIDS. There are many theoretical approaches to using counseling, and as I've mentioned a couple times, it has to be based on the individual client. And finally, the majority of vaccine research is funded through the National Institutes of Health and Global HIV Vaccine Enterprise, and it's important for counselors and sexual educators to stay up to date and aware of kind of what's happening in the development of treatment. So that is our presentation, and our references are included.